Hi, I'm Shannon Wolf, and I'll be talking about anxiety. Now, anxiety is a pretty normal thing to feel for most people. Sometimes we even call it worry. When I think about anxiety, I think about any normal, stressful situation that might cause us to be more thoughtful about something, maybe worry a little bit about something, such as taking a licensing exam or perhaps even learning how to drive. But anxiety can become a problem when those feelings become excessive. Maybe they even take over your life, or your functioning isn't as good as it used to be. So when I think about anxiety, I think about a continuum where we have mild anxiety, moderate anxiety, and then disorders over here on the end. Let me give you an example of mild anxiety. So mild anxiety might occur when you invite someone over for dinner that you haven't had in your home before. And you might be concerned about what to make, or are the people going to like it, or are they going to have a good time at your house? And you probably would spend a little more time on the menu, or maybe just preparing your home, and that's pretty normal. Moderate anxiety would be when you have the very same situation, only you might lose sleep over what to prepare, or you might get irritable, or have some moments where you can't think about anything else but what's going to happen while you're making dinner or having this dinner party. A disorder happens when you have most of your life, most of your days, where you're just concerned about all manner of things. This would impact the way you feel physically, what you think about. You're not able to control those thoughts. So most people, when we talk about anxiety, are going to be up and down the continuum between mild and moderate. Most people don't make it all the way to a disorder, but those who do have a disorder also might find themselves where they're between moderate and then a full disorder. So when you think about anxiety, it's not if someone does have anxiety or they don't, but where are they on that continuum? Now, anxiety also has some specific features. Anxiety disorders include a number of disorders that share features of excessive worry or fear or anxiousness, as well as behavioral disturbances. Let me make a distinction between anxiety and fear. So fear is an emotional response to a very real or perceived imminent threat. For example, if there is a bear chasing you, that would cause fear. There is an actual bear, and that bear is looking at you like you might be lunch, and so it's going to cause you to run faster and get out of the way. So God did create us in such a way that we could have fear responses so that we can take care of threats in a very real and healthy way. Sometimes fear, though, can get out of control. Anxiety, on the other hand, is the anticipation of a perceived threat. So the threat is not present. For example, a bear isn't in the same vicinity, but you might be worried that a bear might come along and cause you some distress. Now, fear and anxiety frequently do overlap, but they also differ. So fear is more associated with the surges of fight and flight and freeze and submit responses. And those are common when one is in immediate danger. And again, they are adaptive. They get us out of the way of danger. Anxiety, on the other hand, is associated with muscle tension and hypervigilance, and that helps us to prepare for a possible threat that might happen. Again, it can be adaptive, but when it takes over our lives, it can be debilitating. So I also wanted to mention panic attacks, because sometimes those also occur with people who have anxiety disorders. And panic attacks are prominent within many of the different anxiety disorders, but usually that's accompanied with a rapid heart rate. It's accompanied with shallow but very fast breathing. People might feel faint. They might feel as if they're dissociating, and they can actually change the way that they live just to accommodate or avoid those panic attacks. It's also interesting that about 13 to 14% of our entire population has some type of an anxiety disorder. Matter of fact, it's probably more prevalent than any of the other disorders that are found in the DSM. So if you're counseling in some capacity, whether pastoral or biblical or professional counseling, chances of you coming across someone who has an anxiety disorder are actually really high. So the question isn't if you're going to see someone with an anxiety disorder, it's how often are you going to see someone with an anxiety disorder. Now, the early onset for this disorder usually happens in the teen years, or sometimes even in the early 20s, but usually in teens. And we even see times in childhood where this disorder is starting to manifest itself. And anxiety tends to wax and wane over time. So in other words, there may be seasons when it's a lot worse, and other seasons when maybe it's not too bad at all and a person's able to function pretty well. It does decrease the quality of life. So even when a person is saying, you know, it's not so bad right now, there's always that thought in the back of their head, but it may show up pretty soon, maybe even tomorrow. And so they tend to construct their lives where anxiety is not likely to be present. Also with anxiety, it's very common for there to be an additional disorder. So anxiety rarely shows up alone, or perhaps maybe two different anxiety disorders. But usually what we see is anxiety along with depression, or anxiety with an eating disorder, or anxiety with a medical condition. But research, interestingly, is showing that anxiety tends to run in families. So there may be a genetic component. So I'm interested in seeing what's going to be coming in the months and years ahead with it, more research on that. It's especially true for panic disorders, generalized anxiety disorders, obsessive compulsive disorders, and different phobias. Now let me give you a list of some of the anxiety disorders. So there's specific phobia, and the more common ones are fear of blood, fear of heights, fear of snakes, or different kinds of animals. Those tend to be the more popular ones. Also claustrophobia is another very common one. Social anxiety disorder is also at the top of the list. A panic disorder, agoraphobia, generalized anxiety disorder, anxiety disorder due to a medical condition, a substance-induced anxiety disorder, and then anxiety disorders that are not otherwise specified. Now those each come with a very specific set of behaviors that are outlined in a diagnostic manual, so you'll need to look at those to be able to distinguish what exactly you're looking at. Now before, I would say within the last several years, post-traumatic stress disorder and obsessive compulsive disorders were also listed as anxiety disorders, but now they are given their own special category. Whether you think that's a good idea or not, they have their own special category, and so you might want to look at those even though they are still considered to be an anxiety disorder. Now there are some difficulties in diagnosing anxiety, and mainly that's because they usually show up with two or more disorders, and I alluded to this just a second ago, sometimes two or more anxiety disorders, and so the clinician might find themselves scratching their head thinking, well, they're doing this, but they're also doing that, And that could be that you're looking at two different kinds of disorders. Sometimes their symptoms even will overlap, which also makes it a little bit hard to diagnose. This is specifically true for symptoms between anxiety disorders and depression. And those of you who have practiced in the field for a while will know that when you see one, it is highly likely that you're going to be seeing the other one. In patients with some disorders like generalized anxiety disorder and social anxiety disorder, the presence of an additional disorder is almost a given. Matter of fact, it's kind of rare when you don't see an additional disorder. Now, there is talk in the field now about a transdiagnostic approach, and that's a really fancy word, but all that means is that instead of thinking of disorders as being separated, consider it perhaps as one disorder. So even though you might be looking at GAD and socialized anxiety disorder, you might look at them as one disorder and then treat them as one disorder, and it actually works quite well, so you might want to consider that. So when treating anxiety disorder, you can think of dividing treatment into 4 distinct stages. One stage is going to be building a therapeutic relationship. The second stage would be doing a very thorough assessment. The third stage would be working towards changing some of those things in your client. And then the final stage would be solidifying those changes. So in building the relationship, I would suggest that this may be one of the very most important things that we can do as counselors. Matter of fact, the research suggests that the relationship between the therapist and the client accounts for twice as much positive change as the techniques that we use. Well, that's pretty significant. So make sure that you are building a very strong therapeutic alliance between you and the person that you're counseling. Now, when I talk about building that alliance, I think about showing a Christ-like concern. We talk sometimes about positive regard, but as a follower of Christ, I want to model that love that Christ has for that individual, that compassion that he shows that individual. And so that person may not be able to pray or may not be able to hear from Christ, but if they can see you and you're modeling that, then I think that goes a long way for them to be able to reconnect with the Lord. Also, during that initial phase, make sure that you're articulating goals. And the person may come in and say, you know, my goal is that I want these feelings to be gone. But we all know that life says we're going to worry sometimes and we're going to be anxious sometimes. And as we talked just a second ago, I think sometimes it could be beneficial because sometimes worry makes us prepare better. It makes us a little bit sharper. And so you don't want the good kinds of stress and the anxiety associated with the good kinds of stress to go away. The other things that I usually do with goals is I introduce this idea of drawing closer to the Lord as a goal. And sometimes I talk about growth and self-awareness and maybe even some self-compassion as a possible goal. When you assess with your clients, make sure you do a holistic assessment. Don't only look for what's going wrong, look for what's going right as well. Now, you told me not to talk about future ones, right? Like future, okay, sorry, okay. Now, what you decide to do inside your therapy session is going to differ between counselor to counselor because we all counsel out of our personalities. And so you need to decide how best to approach your different clients and their unique needs. But I would encourage you, as you wrap up or solidify those last changes, I would encourage you to think about spreading your last counseling sessions out. I think it's important not to end abruptly, but for them to get used to you not always being in their lives. Also, make sure that you shore up their support system so that they won't miss the counselor and that kind of of intimate conversation that counselors have. Thank you.